all for joining us today. Good to see you all. I'm going to be brief this morning. So if we had a dashboard, every light would be blinking red and every warning buzzer would be going off. So as Dr. Spitters is going to detail, we're breaking COVID case records and really headed into uncharted territory. The third wave of the virus appears to be the largest wave yet. Now, the fact that we're entering winter months with the highest case counts yet should really send shivers down everybody's spine. We understand COVID-19 better today than we did back in March, but we also know, and it's been confirmed, that the power to stop it is really in everybody's hands. Wearing masks, washing hands, only socializing with 5 people outside your household in a week. These are really the proven tools we have to get the infection under control. And we do know that it appears that the spread is really now through social interactions in the home with family and friends. And so you've just really got to take that to heart, that you need to really limit your contact even with family members and those that live outside of your home. So we're keeping a close eye on the hospitalization rate. That's one of our key priorities from the beginning, and keeping our hospitals from being overwhelmed is a top priority. So we'll be watching that closely, and Dr. Spitters will speak to that. So I really don't know what's coming down in the future, but if we don't push the curve back down, we will almost certainly have to go backwards. None of us want to do that, knowing the impacts to our economy and our lives, like personal lives and work lives. And so we need to push the curve down, flatten it again, or we will have to go backwards. So let's take this next week to redouble our efforts. We've done it before. We can do it again. We've shown that. And tomorrow I ask you to think about all those veterans we'll be celebrating and the sacrifices they've made. And the least we can do now is to take a few precautions to avoid restrictions tomorrow. So please think of our veterans, think of our families and friends, and take safety precautions. So with that, I'll hand it over to Dr. Spitters from the Snohomish Health District.
Thank you, Executive Summers, and good morning, everyone. I'm going to share my screen with you so we can take a peek at what's been going on in the past couple of weeks. Try to get the right, that should be it. So hopefully you're now seeing a title slide showing COVID-19 update for today. And first slide, I imagine we're all very familiar with this now, and you can see this nearly vertical rise in the past week. This is our 2-week rate through Saturday, November 7. Nearly 190 cases per 100,000, 4.5 times what it was just 6 weeks ago. And we've had nearly a vertical rise since then, particularly in these past 2 weeks. We had 1,000 cases reported to the health district last week. And when we look at the day, this is a curve that smooths out the day-by-day data, which is highly variable. But it's still instructive to look at this slide and see what we're seeing on a daily basis. Last week, we had 4 days last week that exceeded all prior highs, which were way back in March of the year. So, you know, this is really, we're on at a high level and on a steep trajectory that's obviously very concerning. Take you to the next slide. Our positivity rates also are going up. This is an aggregation of all testing done in Snohomish County. And you can see we've been going up steadily for over a month now, up above 6% of tests are positive. That's not, I want to again revisit, we get a lot of people asking or asserting that it's the increased testing that is leading to these numbers. But although we have increased our testing capacity from roughly 6,000 tests per week to a little over 9,000 a week in the past month, The positivity rate is also going up, and the proportion of positives who are asymptomatic has declined from an average of 15 to 20%. We were down to 11% asymptomatic. So these are mostly sick people. 9 out of 10 testing positive are ill, seeking testing because they're not well, and the positivity rate is going up. So this is, by all measures, a true increase. And as Executive Summers mentioned, one of the main reasons we're concerned about this, beyond just the general suffering that the infection causes, is our hospital's capacity to take care of COVID and other conditions. And we visited this a couple times before. You can see back in March, we had up to 70 or more people in the, excuse me, this is May. Back in March, we had up to 100 or more people in the hospital at a time. And hospital capacity was greatly limited. All kinds of other acute and not necessarily emergent, but important healthcare conditions had to be put to the side just to take care of the COVID patients. And even with that, the hospitals were stretched. We're now entering a phase where we've had a big jump a couple weeks ago, then things leveled out. But I want to show you what's happened over the past week. A week ago, we were down in the mid-20s, the number of confirmed COVID positive patients in Snohomish County hospitals. Now we're up to 37 as of this morning. You can see that climb going, and that's occurring all across the state. So we have nowhere else to send our patients if we run out of space here, because everyone else is in the same boat in our region. So this is definitely a warning signal, and it is, I've probably overused this analogy, but it's much like we're driving on ice, that when we hit the brakes, we're still going to keep moving. What we see in the hospital today is transmission that occurred 3 weeks ago. So even if we turn things around now, which Executive Summers and I are strongly encouraging us all to do our best to do that, we're still going to see an increase in hospitalizations, probably going to test the capacity of hospitalizations. So the hospital surge has arrived. It has not been as high as it was before. Hopefully, we can bend this curve and get things back down before it does exceed capacity. Another thing to remember is that a new feature of our hospital issue here, it's not just beds, not just personal protective equipment, which currently are relatively okay compared to prior history, but staffing is a major problem. There's a nursing shortage nationwide and in the region. So sometimes, even though hospitals have beds, they don't have the people to put next to the bed to take care of the patient. So this is I think, an impending crisis. If we don't bend this curve, we're facing serious problems with the hospital. And then, as Executive Summers mentions, then things are going to be out of our hands and we're going to end up having to go backwards. Also, just a couple of other things to show you. You can see the long-term care cases over the past several weeks have gone way up. We had it quite a bit down. And so, again, another signal of what we saw again last spring. And then our deaths due to COVID are starting to creep up as well. And it's worthwhile to note that of the 35 deaths due to COVID that were counted in October, 20% of those were in people under 50 years of age. Likewise, about 25% of the recent hospitalizations in the past 2 weeks have been in people under 60 years of age. So although our older adults are more likely to get severe disease, end up in the ICU or die from this, all ages can have bad outcomes. So excuse me just a minute, and I'm going to come back to our screen. Okay, just a few more remarks I'd like to make. Last week, I mentioned that we were close to finalizing a switch for the lab and notification process. That is the test results getting to the patients used by our Snohomish Health District testing sites. at the Broadway and Linwood Food Bank locations. That change is happening tomorrow, and a new registration link will be going up on our website at www.snowhd.org/testing. For all testing starting Thursday of this week, people will be provided with a unique QR code and instructions to get access to their results within 2 to 3 calendar days of being tested. They will also be provided a phone number to the laboratory for those who don't have internet access or who need further assistance accessing their results. And speaking of phones and phone numbers, on Friday, the Health District reactivated our call center here at the Health District to meet the demand for increasing call volumes. That number is 425-339-5278. The call center is staffed Monday to Friday from 8:30 a.m. to 4:30 p.m. to answer questions about testing, to report positive results of an employee by employers, to get in touch with our contact tracing teams, or to clarify isolation or quarantine instructions that you have received. Now, I'd like to circle back to closing out my earlier comments about the data. These increases in cases, hospitalizations, and we've also seen increases in outbreaks in work settings are alarming, and maybe the introduction, I think they are the introduction to a surge of demand for acute care capacity that, if continued, would overwhelm our hospital's capacity to provide care, not just for COVID, but for everything else that people go to the hospital for. All of this leads me to make what feels like one final plea to please stay close to home, always wear a face covering when outside your home. Holding gatherings is a threat to all. We should stop it for the time being. Plain and simple, just stop the gatherings. Reduce your social activity and other non-essential travel and activity. If it's not for work, school, or medical purposes, I think the safest bet for us all is to just skip it and don't attend gatherings, avoid businesses and people who don't follow the guidance. And please, as Executive Summers mentioned, make a bubble of the 5 or fewer social contacts outside your household and stick to that. And I recommend that you keep it to the same 5 across time till we get a little further down the road with this. When is it okay to have more than 5? Never. It's a bad idea and it's against the rules. Frankly, for the best public health outcome, I recommend, if we could tolerate it, 0 people outside our households at this point. But I think we have to be realistic. People need some level of social support and interaction. But let's do this and bend this curve before our what's needed to turn things around becomes even more difficult on all of us, as Executive Summers mentioned. Again, the big risk factors for transmission are being indoors, not wearing a face covering, and lots of talking to generate that cloud of droplets that other people can inhale. So avoid being together with people outside your home, avoid being indoors with them. And even within your bubble, wear a mask when together and do it outdoors. Keep your time together as brief as possible. And if you're sick, stay home, stay away from others, and get tested. Now, sadly, today I'm here to reassure you, I'm here to inform you more than reassure you. These are some grim numbers we're looking at, and they harken back to a time that was very difficult on everyone last winter. So this is information for you to help yourself and help the community. We may well be facing a hospital surge that's starting now and could continue for weeks to months, but we do have some control in our hands to bend that curve and lessen the impact of that on all of us. Last, I think we really have to accept that we could be in for a very long and difficult winter. We'll have more to say about holidays in future briefings, but for the time being, I encourage you all to start planning small, household-only winter holidays. Doing otherwise is likely to come at a price we should be unwilling to pay. So it's time to commit to protecting our hospitals, shrinking down our social circles, hunkering down at home for the winter, and signing up for delayed gratification to enjoy holidays with loved ones next winter. Meanwhile, our hospitals, schools, and businesses are counting on all of us to help them stay open and serve the people they're there to serve. Think of others and choose and act responsibly. Last, I want to share that I'll be joining Secretary Weisman and State Health Officer Dr. Lofi and others, our neighboring health officers, for their media availability later this afternoon at 2:30 to reemphasize these concerns I've shared with you about the trajectory and level of COVID activity in the community and hospital capacity, and why it is so urgent for folks to curtail their social gatherings now. And with that, I'd like to turn it back to Executive Summers.
Thank you, Doctor. And I'm going to kind of reverse the order of these questions because I think it'll flow a little better. But there's 3 questions regarding the nature of the outbreak, what's driving it. In this week's report, there's schools, some restaurants, retail and a bar, other places outside of social gatherings that we've emphasized today. And can you talk a little bit about what's driving this and what we're seeing? And then I'll come back to the question about what future steps might look like.
Right. So, well, a couple of things from speaking with the state and neighboring health officers yesterday. I think, you know, this is coming from all directions. Certainly the social gatherings, the informal, seemingly benign, but not really benign gatherings, especially without face coverings indoors. We're hearing a lot of that during our case investigations. So that's a key part of it, but not the sole part. When you have this much transmission in the community and an economy that's trying to open, sick people show up to work, or they may not feel sick at the time, but somebody tests positive or they get sick and go home and then test. And now we've got a case at work, and then that they might have infected someone else. So workplaces, there is some transmission going there, although we're having I think overall very good fortune in terms of the interventions in workplaces to reduce transmission and try to keep those to clusters. Rarely do we see a workplace outbreak get up above 5. Same thing with schools. We live in a community where there's lots of COVID, so childcare is in schools, both among the students, the few students that are on campus, and more so among the staff. Come into the workplace or the school and then have COVID, you know, and then that becomes, if there's another case, then we've got an outbreak there. 2 cases, that's an outbreak. And so we've got several of those brewing in workplaces. I think we've got 30, but that's up from about 10 on average open at one time a month ago. Schools, I think we've got about half a dozen school-based clusters of more than 2 cases. Other common workplaces for outbreaks include construction, restaurants, and retail. So we're getting those controlled, but yes, workplaces are part of it, but we're not seeing sustained transmission as much in those settings. So I think that kind of speaks to the kind of universal nature. This is out there everywhere, and it's an easy virus to spread.
There we go. There was a question about will we give any more information about the specific outbreak locations? Is
that the outbreaks that we post on our weekly report, due to privacy concerns, we suppress we suppress all numbers less than 5. So a lot of times it'll just say facility A, less than 5 cases, because we don't want to inadvertently lead to disclosing someone's identity in public as a COVID case. That would be a violation of privacy laws. But we do try to share, we share all the long-term care facility outbreaks with large numbers, and you know, if we have reason to believe that a setting has had an outbreak and that notifying the public would serve disease control benefit, we will most definitely do so.
Okay. So I'm going to go back to the earlier questions about what some possible future steps might look like. And then there was a question whether it's a local decision or a state decision. I'll just start by saying, you know, throughout this year, we've tried to coordinate with our adjacent counties and with the state. And I do think personally that it's better to have a widespread, broad reaction to this. And so we will be talking with the state again this week. I know they're very concerned about the situation. In fact, I haven't looked at this week's numbers, Doctor, but I think we're actually in a little better situation than King and Pierce counties, for example. And so, but we will be talking with the state government. I know they're having this exact same conversation about what the next steps are. I think whatever that is will probably be more nuanced than what we saw in the spring, because we do have some experience with workplace settings and other situations, but certainly a stay-at-home order such as we had this spring is something that's on the table. And what we're trying to do is really reinforce the message that at the end of the day, you can have orders and you can have restrictions, but at the end of the day, it's going to be individuals and families, people in their home settings and with their social groups that are really going to control this thing. And so that's kind of the situation, and we'll probably have more information on that next week. Doctor, do you want to respond to that too? What you see might be potential future actions?
Well, that's right. I think as the health official, you know, my role and all the folks that work with us at the health district, our role and goal is to provide the community and our policymakers and elected officials with the information they need to make the holistic decision. We come just from the health end, and then try to help provide them with the information about, you know, what fits in the big picture. And I agree completely with Executive Summers that harmonizing with the expertise and policy of our state and regional partners is the way to go, and that's a process that will is always ongoing as we have been navigating through this, and it becomes more acute at times like this. So I think we all will stand together. And again, as Executive Summers mentioned, I think whatever transpires from here out, a lot of it's in our hands. And that which, if we do have to impose restrictions, I agree, they're likely to be more nuanced now that we know a little bit more about the virus than we did last spring.
So there was a question about why we're sort of maybe delaying action or aren't quicker on the trigger with some mandates and things like that. I'll just say from my perspective, I know it was about a week or so ago, it looked like we might be leveling off. You saw that little inflection in the curve. And so this is a moving train, and we're watching the dashboard every day to see whether our actions are having effect or not. And so it's clear right now we're in a spike that really exceeds the previous spike. So there's a higher sense of concern. And that's really just become evident over the last few days. So again, we will be talking with the governor's office and the state and all our partners about what the next steps are. But you know, it's not easy. It's a moving target, and we do believe that we need to do this together, both as counties and as a state, really to get this under control. So let's see, is that okay? There was a question about the long-term care facility spike. Is it driven largely by the facility in Monroe, or is it more widespread?
Well, the facility in Monroe, it's not over, but it's slowed down there. And no, this is roughly half a dozen facilities. Again, when you have this much COVID in the community, the people that are working in or that formerly were visiting, I think visitation is kind of decreasing now, but people inadvertently introducing the virus into the facility, and here we are. So I think there's roughly half a dozen clusters or outbreaks with more than 2 cases. And while 2 or 3 weeks ago, we could have said that that's mostly driven by a single facility, that's not the case anymore.
Another question about the restaurant. There was a restaurant that had 11 cases reported, and is that just employees? Is it public, and shouldn't a facility like that be shut down and the public notified?
Well, it's always certainly there's a variety of factors that could impact a decision to shut down a food service establishment, and the part of it is if they just don't have enough, if everyone's isolated or in quarantine, then they just don't have enough staff to run the place. If they can run the place and they're cooperative and their practices meet our review and meet the guidelines, and they're doing everything they can, then then we will tend to watch closely but let them operate. The reason being, a lot of times the large number of positives that you see, it's not serial positives. There's a case or two, and then we go in and test everyone, and then we get back all these positives. We send them all home. We send their contacts home, and then reset and try to help them start over again safely. In these settings, usually the problem is behind the counter, back in the kitchen, and the patrons don't meet the definition of a contact in terms of time and proximity. If we do feel that they do meet the definition of a contact in terms of time and proximity, then we would make a public notification about that.
Are there any indications that COVID is behaving any differently in this surge than prior surges?
Well, I think it's behaving as we've seen it behave in our presence last spring, and to a lesser extent in the summer with the second wave, and what we're seeing in various places all around the country, that it gets momentum, and like any logarithmic process, if one infection leads to 2 infections, then 2 leads to 4, and 4 leads to 8, and things take off quickly, like that curve shows, where things go almost vertical. So I don't think it's changed at all. It's just we've, in a sense, the cat's gotten out of the bag, and now we've got to work hard to try to get it back in.
Okay, another question for you, Doctor. What defines someone meeting the definition of a contact in terms of time and proximity when the health district is performing contact tracing?
Within 6 feet for 15 minutes.
What do you say to people who are putting all their eggs in the vaccine basket?
Yes, well, I'm sympathetic, and I also have a lot of hope for one or more vaccines to come forth and ultimately to help us navigate our way out of this chronic emergency state that we're in around COVID. But the day of benefit from that, even if this rolled out next week and everything went lockstep as planned, it will be 6 to 9 months probably before the general, the majority of the public starts getting vaccinated. There's a prioritized tiered approach to vaccinating the most vulnerable or the most critical members of the workforce and most vulnerable people in our society, people most likely to end up in the hospital, and then branching out from there. And initially, the supply is going to be scarce, and the capacity to deliver it, to not only to deliver it to the doorstep of the clinic, but to get it into people's arms, that's going to evolve over time. It's going to take probably 6 to 9 or 9 to 12 months in a best case scenario to get everyone who wants to be vaccinated. So the fruits of a vaccine's offerings are not imminent, and they're not going to help us with this current wave. They may not even help us if there's a 4th wave. We've really got to stay with all these prevention measures we're talking about right on through the vaccination effort, likely for another year.
Just want to add on to the end of that, we do have a good plan in place. Our team at the health district and at our Department of Emergency Management have worked really hard to put together a good plan with first responders and medical facilities. But there's going to be some real logistical challenges. As the doctor mentioned, just the supply, the vaccine that was discussed earlier this week is from Pfizer that looks like it's got a good chance of being somewhat effective. It has to be stored at 100 degrees minus Fahrenheit, so not the type of facility and capacity that is just laying around easily. So we're scrambling to be ready for those types of eventualities. But again, we're doing the best we can to prepare. But as the doctor said, we're expecting really mid next year to really have this kick in, assuming everything still pans out with the vaccine or other vaccines that are in the works. So. And I'll just finish up. There was some questions about contact tracing. Doctor, are people cooperating? How's that going?
Well, the majority, I think, like everything we've been talking about, I think the majority are doing their best. We do get some people that don't respond to our calls or who won't give us their contacts' names. But the majority, 70 to 80%, are cooperating. In general, that's good enough to contain. Obviously, if we had 90 to 100%, it'd be quicker to bend the curve. And I encourage everyone out there, when the health district calls you, please work with us. Your well-being, the people around you are our primary interest, and your privacy is foremost in our minds and in our practices. We need that. We could do better, but overall, 70 to 80% is better than average statewide. I guess I'd put it that way. And our staff are working very hard. There's 50 people at the health district working on this.
Thank you all.
Thank you, everyone. This is Carrie Bray in the Joint Information Center. We're going to go ahead and wrap up for today, but please do stay tuned for future media availabilities. Thanks.